So, welcome everyone today to our workshop on understanding and supporting behaviour. My name is Kelsey Odgers, and I'm from the Psychology in Schools team. I work as a clinical psychologist, and that is part of the Norfolk and Suffolk NHS Foundation Trust. And I'll just hand over to my colleague to introduce herself.
Hi, everybody. I'm Emmeline Guaspari. I'm a principal clinical psychologist, and I also work in the psychology in schools team. So, welcome, everybody.
Welcome. Perfect. So, we just wanted to say that this workshop today is part of our mental health and wellbeing parent carer workshop program, but we also offer a separate parent carer workshop program, which is around childhood neurodiversity. And that gives specific advice and guidance from parents and carers of neurodivergent children. So, if this applies to you, please use the QR code on the slide or use the link to find out more because we have a whole host of different workshops as part of that separate workshop series. And we're going to be saying more about this at the end, but we just wanted to highlight that separate workshop series at the beginning, if you, just in case you weren't aware of that. Great. Okay, so the aims of the session. So I guess what we firstly wanted to acknowledge here is that this is a huge topic. We could talk about this for hours and hours and hours, but it's just recognizing really that this is an introduction to really spark some initial ideas and highlight some things that you might want to think more about. But we won't have all the answers. So it's really a bit of a starting place to spark some of that curiosity, think about behaviors possibly in a different way, and then give you some ideas and hear from other parents and carers as well in this area. I think that's a huge part of this workshop. So yeah, so just to give you a bit of an overview, so we're going to be thinking about a definition of the behaviour, so thinking about exactly what we're talking about. So we're going to talk a bit more about some of the definitions in this area. Then we're going to be considering what's underlying these behaviours for our young people. So we've got an analogy we want to kind of give you around an iceberg to really help us understand that. And thinking about within that, what could these behaviours, be there for? Why might they be present and what might be going on for our young people and really exploring that. We'll also be thinking about what's happening in our young person's brain when these behaviours show up, a really helpful model that we share in relation to that you may already be aware of if you've joined us previously. And then we'll be thinking within the second half about specific things that you can do as parents and carers to support your young person with these behaviours. So around skills development, helping to set up our children for success and thinking about compassion and really connecting with our young people. So as I said, this is about making us curious, giving you some ideas that maybe you haven't tried before, hearing from other parents and carers in a similar position, and then we'll be including some signposting and resources at the end if you did want to kind of find out more. Perfect. So we just want to, as a starting place, hear from you. So what behaviours do you see in your child that concern you? So maybe what are some of the behaviours that you're seeing that's brought you to this workshop today? And this is open text and you can, contribute as many different responses as you want to. And I can see people are typing. Okay, so not listening, someone's saying here. Shouting, yeah. Other people sort of saying something similar here about kind of not listening, that feeling really tricky for you as a parent and carer. Meltdowns, negative self-talk and not listening. Yeah, so what do those meltdowns look like? What are the specific behaviors we might be seeing in those meltdowns? Yeah, getting into trouble at school, so different behaviors that are being seen in different contexts, maybe between home and school. Yeah, other people talking similar things about shouting, meltdowns, negative self-talk. Again, aggression, what might that look like for your young people? Yeah, outbursts, hitting and punching self, so some self-harming behaviors. And we've got some links at the end, more around self-harming support and crisis support too, if that is relevant. Swearing, yeah, throwing things, impulsiveness, so yeah, and some hyperactivity as well. Okay, so lots of different behaviors, but also you can see that there's lots of overlap between what people are saying. So that kind of shared experience for many of you coming here today. Thank you for sharing those. Okay, so how do these behaviors make you feel as parents and carers trying to support your children? What emotions does this bring up for you? Yeah, it makes you feel stressed. It can be incredibly stressful, can't it? And isolated. Yes. So really kind of difficult, big feelings coming up. Feel like you're failing, feel frustrated, sadness, you can feel burnt out, confused about what's going on. Yeah, feeling frustrated and angry and powerless in that situation. Yeah, kind of linking to that kind of hopelessness that someone talked about, feeling guilty about what's going on. Yeah, that's an often a big one, isn't it, for us as parents? Guilt, I think. Yeah, feeling unsure how to respond, that linking to that confusion that someone else was talking about, and embarrassed. Yeah, so thinking about where this behavior is showing up, maybe with in front of other family members or out in public, and that can feel really tricky. Yeah, someone else talking about being scared about the future. So I guess this is really highlighting that these behaviors can evoke such strong emotions for us as parents and carers. And it's because it comes from that deep sense of really loving our children and wanting the best for them. Um, yeah, so thank you so much for sharing those. How do these behaviors make your child feel now? So kind of really connecting to what, what might be going on for your child and how they make them feel. Yeah, so scared. Yeah, so similarly to what other people, parents and carers are talking about, when people can feel scared, they can feel embarrassed, especially if this is happening maybe at school in front of their peers. They can feel confused in the same way that we can. They don't know maybe what's going on for them in those moments. They can be angry, frustrated, feel out of control, really overwhelmed, people are talking about here. Yeah, frightened as well and upset. Yeah. So we can really see those parallels between what we might be feeling as parents and carers about these behaviors and what our children and young people will be feeling. So they just really do invoke such strong emotions in us. Yes. Okay. Thank you so much. And then I guess a bit more broadly, how do they affect family and or school life? So the impact really that this has for your young people on the different areas in their life, and also the impact that it has more broadly on your family life, um, your young person's family life. Comparing children, yeah. So that might be us as parents and carers comparing, different children if they have siblings as well, but also within school, comparing them to other peers. Yeah, they don't want to be at home. It can affect where they want to be. Sometimes it can, make it difficult for them to be home or at school, not feeling understood by others. Yeah, masking more with other people, yeah, and that can then sometimes increase some behaviors too, can't it, in different context. Impacts their learning at school. Maybe they're struggling to get in school or they're struggling to engage with the lessons and things in school for different reasons. Feel like we can't go out much as a family because we're worried about meltdowns. I think that's such a significant thing, and we hear this a lot. That it can really impact, therefore, the whole family as well as the young people. Yeah, basic tasks feel too hard, so kind of managing that day-to-day life it can impact. Not taking up opportunities, getting into trouble at school, maybe that linking back to not feeling understood by other people. Yeah, friction in parenting with other partner. Yeah, so kind of those dilemmas that we can face within our parenting if we're trying to co-parent alongside our partners. Yeah, not enjoying school, cannot concentrate, which can impact learning, cannot sit still to concentrate, falling behind. So, really, that significant impact in terms of the academic side of school, but also more broadly about other aspects of their school life that they're not being able to enjoy. Yeah, always on edge, not knowing if my son will have that meltdown, and that can really impact what you feel you can do and just your emotional well-being. Takes up lots of time that I can't spend on fun and family time. Yeah, so these behaviors can take up such a significant proportion of family life, can't they? And our own capacity as parents and carers to be able to manage other things. Yeah, siblings miss out because the other doesn't want to leave. Yeah, so the impact then on siblings can be so huge here in so many different ways. And again, you can just see from what you guys have said that overlap, those themes that are coming out for all of you. And I hope that one thing that you will take away from this workshop is that you're not alone in this, because as someone highlighted previously, it can feel incredibly lonely to be in this position as parents and carers. Okay. Thank you all so much for sharing those things. And we've got a few more Slidos, particularly in the first half, which we hope are helpful. Okay, so linking back to kind of the aims, we talked about the importance of really defining what behaviours we may wish to support. What are we actually talking about here? So what we're talking about are behaviours of such intensity, frequency, and duration as to threaten the quality of life and or the physical safety of the individual or others around them. So as we said, those different aspects those different impacts that these behaviors can have on you and your young person and those around them can be so significant. And this can be a really tough situation for you guys to be in as parents and carers, as you've, so openly highlighted, but also for our young people. So this is exactly what we're talking about today. But in doing this, we also wanted to kind of recognize the different language choices that we can often hear when we think about these behaviors. So a term which often comes up in this behavior, in this area, sorry, is challenging behaviors. And you may have heard of it. Or behaviors that challenge is another one. So this is a term that many people use to describe their experience of behaviors that others around the child feel difficult or challenging, find difficult or challenging. Okay, so it's about those other people around the child finding their behavior challenging. So while some people prefer the terms behaviors that challenge or behaviors of distress, we know that this is a really personal choice. Okay, and you guys as parents and carers and your families will have, different preferences around the use of language here. But there is a shift away from the use of challenging behaviors, as behaviors may not be challenging for the individual showing the behavior, but it may cause challenges for those around them. And this term, it's felt, can put the problem or difficulty in the child. And also, we know that the term behaviors of distress maybe doesn't capture all behaviors. So, for example, behaviors may be related to feelings of excitement, which could still be challenging for a parent or carer. So, we wanted to acknowledge here really that language is a really personal choice for all of us. So, when answering those questions in Slido, please use whatever terms feel fit for you and be respectful of, and we will be respectful of that, of course, too. But we will be using or thinking about behaviors of communication for the purposes of the workshop today, because it's really kind of thinking about that idea that all behavior is some form of communication. Okay, and we're going to be thinking more about that using a particular analogy. Um, we also think much more about this language in the context of childhood neurodiversity. And we do have a specific workshop, and we've put the link there on this slide around understanding and supporting behaviour, which fits within our childhood neurodiversity parent carer workshop series. So if this applies for you, if you have a neurodivergent child, then please, I would encourage you to access that link and watch that workshop too, because we do focus quite a bit on language, particularly in that context too. Okay, so thinking about some of specific behaviors, and some people have touched on this already, which of these behaviors occur for your young person at home or at school? Now, this is a multiple choice. Be helpful just to get a sense of, and you can select multiple ones, which ones your young people might be um, showing. Yeah, yeah. So I can see already that all of them have been selected at least once. Yeah, and we've talked a bit about shouting and screaming and the aggression. Refusal behaviours, I think they can be incredibly difficult, especially if that then has like a knock-on effect, as you guys were talking around kind of school attendance and then the impact therefore on kind of academic side of things at school. Okay. Well, thank you all so much for selecting those. And we're going to be thinking about why children might display some of these behaviours later on. So we use an iceberg analogy to think about, does behavior have a purpose? And you may have come across this already before. But essentially, we think about the behavior that we see, which is kind of being above the water. So behavior kind of being like an iceberg. So what we see is the behavior, which is that tiny bit there on the surface above the water. And then what's underlying the behavior? So, what's then going on below the water? And we feel this is relevant for all behavior, but particularly those who struggle to find the words to communicate, or perhaps those younger children. And as you guys selected on the slide right at the beginning, many of you are coming with younger children in mind. So, this might be really relevant for those young people. So, often all of us respond to the behavior that we see. So, that behavior, like I said, above the water. And we can all do this, especially when emotions are high and when things feel really difficult. We're kind of responding to what we see. But this analogy really reminds us of the importance of trying to really step back and really consider what might be going on below the surface, what might be underlying the behavior for our young people. Because what might be below the surface might be things that we don't necessarily see. Yeah, look at that iceberg. The majority of it is below the surface. Okay. And our young people might not always be able to make sense of that. And really linking back to your SIDO responses, your children can often feel confused and overwhelmed because they're not sure about what's going on for them below the surface. So we know that children's emotions are driven by the need to feel protected and feel free from pain, as it is for all of us. That's human nature, isn't it? So some children display these behaviors because of an emotional need. They may be finding it difficult to express their emotions appropriately. And others express behaviors to communicate something or due to an underlying learning difficulty or developmental need. And for some children, they can't always find the words they need to communicate their wishes, especially those younger children or those with communication differences. And this can lead to a child acting out as a way to communicate a need. So the behavior really, what we're saying here is communicating what is going on. So we need to try and be curious about that. And I want to be really clear here. In the moment, it's so difficult to do that. I'm a mum of a toddler who's having some big emotions right now, and I could certainly relate some of the things that you guys were saying in your previous Slidos. And in the moment, it's really difficult to not just see the behavior. It's really difficult to step back and be curious. But I guess this is just inviting us today, when things are calm, when we're not in those heated moments, to really try and step back and think about, what could be going on here? What could my child be trying to communicate through their behavior? So as we said, we need to try and be curious about this. And often what can happen is the young person and their behavior can almost become a bit entangled, whether that be within a family context or within a school context. They could become the naughty one, the aggressive one, the controlling one. So, what we're really trying to do here is help to separate the person from their behavior and really view their behavior as a way to communicate what is going on for them, perhaps an unmet need. And some of those things we can see there on the screen. And as we said, as a parent in care of myself, this is so difficult. It can be confusing, as you guys have highlighted, it can be overwhelming, and it can be really frustrating and also embarrassing too, depending on where we are. And this can be the case, especially when our child cannot tell us what's going on for them. They can't communicate that with us for whatever reason that might be. And that can make it really hard, therefore, then to step back and view the behavior differently when we're managing that really on a day-to-day basis. And we're seeing the impact that it can have. All those things that you guys talked about, the impact of these behaviors can be so significant on us, for our child, for our other children, if they have siblings, but also much more widely in that as well. So we really wanted to present this as an analogy for you, as a first way to begin to help you change your thinking around the behavior and try and be more curious about what your child might be communicating through their behavior. Okay. So hopefully that kind of makes sense. And really linking to that, thinking about the purpose of behavior. So as we said, we think a lot about what could be lying beneath the surface. So kind of that function or the purpose of behavior is another way to view that. And we really want you to start to think about this for your young people. And we've got some Slidos next to really help try and support you in doing that today, because hopefully this is giving you a space to be able to do some of that stepping back that we know is really tricky to do day to day. So I guess we can think about the purpose of behavior, the function of behavior in different ways, and it can often fall within four categories. So the first one is the behavior may enable the child to access something they want or need. So maybe they're wanting physical closeness to a safe adult. They may show different behaviors in order to get one-to-one time with a parent or carer, or maybe someone in school. And even if this is in the context of the consequences of behavior, so we know that any attention is attention, no matter what the function of that is. So that's the kind of first broad category. The second one is it enables the child to avoid or escape something that they're struggling with or something they maybe dislike. So, for example, you might be seeing the behavior on days when they have a specific lesson at school that they might struggle with for different reasons, or as a way of avoiding going into school, perhaps, or a particular lesson. Or it might be that they're, struggling with a different activity outside of the school context, maybe something at home, and that's when you're seeing the behavior showing up. Maybe also it's there to communicate that they're struggling internally. Maybe they're struggling to articulate something. It could be an emotion, for example. It could be pain. It could be hunger. So I know for my child, when they're hungry, that's when these big emotions are going to show up. And maybe it's because they're struggling to kind of communicate with me in the moment. And that's what those behaviors are showing up to do. And it also could be because of sensory or physiological needs and stimulation. And we know that certain situations and settings can cause sensory overload for some young people, and that can feel really overwhelming for them. And that can be when these big behaviors show up. So it's really inviting us to kind of think about these four areas, think about some of those behaviors in our young people, and be really curious about, well, what could be going on here for my young person? So as I said, we've got some Slidos now to really help us think about that. So, I guess thinking about recent examples when those behaviors may have shown up for your young person, what might your young person be trying to avoid with their behavior? So, have you got any ideas of something your child might be avoiding with their behavior? Homework. Okay, so it might be a particular time of day when you're trying to do homework. It might be a particular homework from a particular lesson, for example, that they're struggling with, and therefore, avoiding that through their behavior. Reading, yeah, so similar kind of theme there. Going somewhere they don't want to, so that can then lead them to become dysregulated, and those behaviors then show up. Yeah, having a bath, so those kind of day-to-day activities of daily living. Other people talking about kind of personal hygiene as well. That can be often be a huge one, can't it? Especially for our pre-teens and teens, stopping doing something that they enjoy doing. Yes, those transitions really between activities, particularly if it's something they're enjoying, can feel incredibly difficult for lots and lots of young people. And I think us as adults as well. I know I struggle to do that. Yeah, accountability sometimes if they're having to be maybe accountable for something that's happened, finding that really tricky. Um, yeah, talking about difficult things, so they might use behavior, you know, to avoid doing, yeah, talking about things that are tricky. Yeah, other people stopping, yeah, talking about stopping play or doing a task that they're enjoying. Having a haircut, and again, that there might be sensory reasons around that, or other things that other reasons they find that particular activity tricky. And the same with kind of those personal care and washing and things. There can be different reasons why young people struggle with that, and therefore, want to avoid that. Yet, leave and get ready. Okay. So we're moving on now to give an example of something your child may want or need when they display the behavior. So what might they be needing or wanting? And just to say you're experts in your child, your family life, so useful to think about this and your own family and what it might be indicating for your child. Okay, what it might be communicating. So they're food, drink, yeah, attention. Maybe you've got other children and they're wanting that one-to-one time with you. That quiet time as well. Yeah. So sometimes if we're living in busy households, some children really need that, and maybe that behavior serves that purpose for them. Yeah. If they're tired and they're needing sleep, they might be wanting that care and love, and maybe that's the way that they're getting that. Yeah. Screen time. Other people talking about attention, that privacy. So similar themes here that are coming out. Great. Okay. What might your child be struggling with internally when these behaviors show up? Um, so yeah, what are the feelings that your young person might be experiencing, which might be driving some of these behaviors? Or what might be some of those emotional triggers for these behaviors? Because often it's the feeling that comes first, and then it's the behavior that follows. So yeah, confusion. Yes, they're feeling confused about something, maybe in different environments, and that's leading to these big behaviors. Annoyance about something. Maybe they're feeling overwhelmed. It could link to that sensory overwhelm as well that I talked about already. What they feel like doing versus what they know they probably should do. Yeah, so maybe that internal struggle that they're feeling, and that can then lead to big behaviors. Yeah, frustration and anger. People saying, yeah, unsure. So it might be your child is feeling unsure. It might be you're actually saying, I'm a bit unsure about this. And maybe it's just sort of trying to think about and turning on that curiosity in moments when things are calmer for you. Yeah, overwhelmed when there's a change of routine or a plan. Right. Okay. And what is the outcome of their behaviors? So what is the outcome of some of these different behaviors? So what does your child get in response to them? And be really honest here, it's important to be honest. Do they get more one-to-one time? Do they get more of that attention, if that's what you're wondering that they might be wanting through their behavior? Yeah. So for people saying for them it feels exhausting, and for the young person potentially feels exhausting. yeah, some parents being really honest and saying, sometimes I can shout as well. And I think, these emotions are really contagious, aren't they? It's that kind of emotional contagion. When other people around us are dysregulated, it's easy for us to become dysregulated. Yeah, young people saying they get more attention. Maybe they get a timeout and they're getting that quiet time potentially through that timeout. Um, they miss out on something. Okay, so they have maybe some things taken away from them, or they can't do certain things. Um, yeah, something they like gets taken away from them. Yeah, so they get, okay, their ear defenders to help regulate noise, to help really regulate them. Okay, thank you. Okay, so I guess the final slide before I hand over to Emmy is thinking about the impact of behavior. And we've touched on this throughout, but we felt that it needed its own, special slide because we know that it can really have a significant impact across lots of different areas. So yeah, really, really significant impact. So it can impact them at home, as you've already highlighted. It can impact activities, even just like daily care tasks, washing, dressing, eating, sleeping can be really, really tricky as a result of these behaviors. School, again, a huge one. I think it's been a huge theme from the Slido responses we've seen. It can impact attendance, it can impact lessons, doing homework, can have such a significant impact, but also on their relationships. And this is something that's been kind of alluded to throughout. So it can really impact their relationship with you as parents and carers, trying to support them and understand them, can impact their relationship with siblings. As people have highlighted, siblings can often feel really frustrated by this and also maybe confused or scared as well as other family members. But it also can impact your young person's relationships with their peers at school. And this can really, in turn, impact a young person's sense of self and their self-esteem. So how they feel about themselves, because they can almost get caught up in a bit of a negative energy that others have around them. So, for example, because if it has a huge impact on what you can do as a family, because you can't go out, because maybe you can't trust your young person not to display that behavior, and that leads to feelings of embarrassment for you as a family, then everyone in the family can end up feeling frustrated. And that's a really understandable feeling to feel if you're in this situation. And that can end up leading to kind of feelings of annoyance and also maybe resentment because of these behaviors. And that can then be internalized by the young person, and they can maybe start to feel negative about themselves, but also thinking about their relationships with their peers. If they're struggling to relate to their feelings and emotions when they're at school and they feel overwhelmed, they start to display these behaviors, then the peers around them might feel confused or frightened. And that can then impact whether or not they are able to kind of build those meaningful friendships, which in turn has a really big impact on their self-esteem. And you might be seeing this with your young person already. So I guess it's really highlighting here that the impact of behavior can be quite negative and it can be really destructive as well, hugely destructive for that young person's life and those around them. And that's so overwhelming for us and for them as well. And I guess this is why you're here today, to really help try and develop a greater understanding about what's going on for your young person and then use some tools to hopefully support you and them in this area. So with that said, I'm going to hand over to Emmy now, who's going to be focusing more on the tools and ways that you can support your young person with these things. Thanks, Emmy.
Thank you, Kelsey. Okay, I'm going to just move the camera because it keeps sitting on top of all the words. So let's have a little think about how can we understand your child's behavior. We've talked about the importance of that and actually how tricky that can be. I think especially when we're busy households where we've got multiple children, it's really, really tough to kind of take that step back and really think about what's driving that behavior. So, so one way to do that is something called an ABC chart. And if you're a busy household, you might go, well, this is going to take me some time to do. Yes, it is. We're not going to pretend, but it is really worth spending that time to do it. So it's a really useful method of understanding what's going on for your child. So we're trying to interpret and make sense of your child's behavior. So essentially, you're recording what you see specifically in terms of your child's behavior. So being really specific about it and also considering why the behavior is taking place. So it's important for us to use this when we're feeling calm as well. So maybe not when we're really het up and really stressed and shouting at our children. This is about us taking that step back and looking at the behavior and really exploring what might be happening. So we can then help work out a way to help you with your child. So it's about taking a little bit more of that distance using the ABC chart. So it can make it difficult to see any patterns or clues or signs of build up. Totally get that. And it's sometimes not until you kind of do this for a little while. So, and we're all human beings and busy parents managing lots of different things. So, we want to keep it real as well. We usually say to parents that want to give this a go to monitor no more than three, what we might call negative behaviors, not a great term, but and then three positive behaviors. So we're kind of really looking at that balance, but also not overwhelming you by getting you to monitor every behavior that they're presenting with. So it's about keeping a behavioral record to start to see any pattern. So this is the idea. So the chart asks us to note down the date, the time. So what was happening before the behavior took place? So that's called an antecedent. I know it's a fancy word, but basically it was what was happening right before that behavior kind of happened. And really taking note, maybe it's where they were, who they were with, all of those different things. And then thinking what the behavior actually was. So, what were they displaying? Was it that they were shouting? Was it that they were kicking? Was it that they were swearing at somebody? So, what was the behavior? So, literally, really honing in on what it was and what happened as a result of the behavior. So, Kelsey's just done the slider about what do your children get from it almost. So, what happens after that behavior? As a result. So it might be that actually they feel much calmer. They're kind of going to chill out by themselves. It may be that you're giving them more attention. So all of those things you've just talked about. But by mapping it out, you're kind of getting a bit of an idea about when certain behaviors may kind of display and also maybe why. So what's driving it? So once we've sort of charted it a few times, we can start to look at those patterns and understand more about the function of that behavior. So is it about avoiding something like Kelsey's just talked about? Sorry, and my lights keep turning off and where I am. I do apologize for that. And I have waft my arms, so it might be a little bit dark. So, so is this behavior for attention or for the need to be or for a need to be met? Is the child in pain or unwell? Or maybe hungry, we talked about a minute ago as well. Is there another trigger for the behavior? Something that someone has said, being asked to stop or start an activity. Some of you were talking about it's really tough when they're asked to stop gaming. So has anything changed in their environment when the behavior occurs? So some of you are talking about actually this happens sometimes when we're asking them to go out, maybe. So once you've done this, it feels often a little bit less confusing as you can start to think more about how to manage the underlying needs or functions with specific strategies, which we'll come to in a bit, I promise. You can think about this with another adult as well, so you don't have to do this by yourself. And maybe you could also do this in conjunction with school. So if some of these behaviors happen at home and at school, it's helpful to see if the pattern is the same, or if it just happens in one setting, maybe just focus on that setting specifically. It can be really, really helpful to involve somebody else to help you look at it as well. So just to hold that in mind, whether that's a relative, a partner, or the school. So this is about us being curious. It's not about us blaming. So, you know, we're being detectives. We're being curious about what's underlying that iceberg, what's driving it. So you can involve your children, for those with older children as well. So maybe not for those ones with little children. And when they're calm, thinking about, can you help me figure this out? What happened before you did this thing? And how did you feel afterwards, maybe? So really kind of thinking with them if they're slightly older. Once we know what the trigger of the behavior and the consequence of it is, what might reinforce it? That's the kind of, so the consequence is the bit that keeps it going often. We can then problem solve these and think about how to stop accidentally reinforcing some of those behaviors we don't want to see in our children and how to reinforce those more positive ones that we want to see more of. So it's about us trying to work out how can we rebalance in essence. So now we're going to move on to sort of thinking about what happens in the brain for our young people when those behaviors occur or show up. And I appreciate some of you might have been on some of our workshops before, so you may already be a bit familiar with this. But if not, that's great. And if you are, then this might just be a really helpful recap, really. So we're not going to go into massive amounts of detail here because, like I've said, there's other workshops that you can look at where it tells you a little bit more. But it's helpful to kind of hold in mind that our children's brains are developing and they're not, fully developed like our adult brains are. So, they don't fully develop until their mid-20s. So that part of the brain that does a lot of that problem solving particularly. So so that's really important to hold in mind. So when we understand what's happening in our brains, we want to kind of show you this model, and it's a model by Dan Siegel, who's an American psychiatrist who has done some amazing work, which is really accessible and helps us to understand what's happening in young people's brains. I really like this as a parent. I like this as a clinician too. So essentially, we think about a brain as having an upstairs and a downstairs part of the brain. So a bit like a house. So the downstairs part of the brain is the emotion center, and it's sort of the bit that has the responsibility of keeping us safe from danger. So it's kind of responsible for triggering what we call our fight, flight, and freeze response in our bodies, which gives us the best chance of survival at the end of the day if there's a real danger. And the emotion part of the brain is the bit of the brain in our children that is really well developed because it's kind of the bit we're really born with that's kind of doesn't need a massive amount of fine tuning along the way. Now, the upstairs part of the brain, in contrast, is like a control tower. So it's an absolutely amazing part of our brain, and it allows us to do all these wonderful skills that you can see on the slides, like planning, organizing, problem solving, and that flexibility of thinking. Some amazing kind of skills that it does. Um, and often what it does, it kind of gives us that kind of sense of feeling a sense of control. So, but like I said, this part isn't fully developed until the mid-20s, so about 25 years old. So it's a work in progress in our children and our adolescents. So our task as parents is to support this development and the integration of both the upstairs and the downstairs part of the brain. So we're almost responsible for those stairs in the middle, so they can keep going up and down in the house almost. So when we're feeling calm and relaxed, and the upstairs and the downstairs part of the brain work well together, that's when we kind of can feel calm and relaxed, or we can still feel a lot of those different emotions because emotions are a natural part of our living. But we're able to make some really good decisions because we're not feeling totally overwhelmed and driven by those emotions. So, in other sort of words, it's really important that we help our children to integrate and help that upstairs and that downstairs part of the brain to communicate well. So, however, big feelings like anxiety are overwhelming and often take charge. So, that's when the downstairs part of the brain sort of takes control. And it means our upstairs part of the brain is temporarily unavailable or offline, if you want to call it that. That's maybe a more fancy term for young people, and is no longer in control. So it totally takes over. Now, this is called flipping the lid. Now, some of you might like that term, some of you might not. I quite like it because it is what happens in that moment for me. So our prefrontal cortex, which is the bit, that upstairs part of the brain that does that planning, organizing, problem solving, and flexibility of thinking, is no longer available to us or not fully available to us because that emotion part is really driving us. And what this looks like is often our young people appearing completely overwhelmed with emotions. And this doesn't happen just to our young people, it happens to us as adults. And some of you were describing, well, I end up shouting, I feel really frustrated. So sometimes when our children flip their lid, we sometimes also flip our lids as parents. So we're not blaming because that is just sometimes what happens to all of us as parents. So we often want to be able to rationalize when our kids flip their lids and settle them down when they're overwhelmed by having a chat or a conversation. And that's really difficult. I don't know about you, but that feels like an impossible mission sometimes when I do that with my children. But we are often drawn to trying to make sense and have that conversation when we know they've been in trouble in school, maybe. Um, But actually, that's sometimes the time when they can't access that part of their brain to have that conversation with you. So it's not until that upstairs part of the brain comes back online that we can have some of those conversations. So they won't be able to hear us or take in what we want to say or the conversation we want to have. They're purely driven by that emotion when they flip their lid. So we want to get that lid back down and that upstairs brain back online so they can begin to regulate and manage their feelings and their behaviors. We cover this further in other workshops, so just so that you're aware. So we'd really encourage you to watch maybe some of our other workshops like the Big Feeling workshop, and we'll signpost you to that at the end of the workshop. So if you want to know a little bit more about it than we're going to cover today, that's a great place to go. But we just want you to hold this in mind. So having that sense of my child has flipped their lid and being aware that when we have flipped our lid and how this can keep both the lids offline. So this can also trigger other family members to flip their lids too and keep everyone's lids offline for longer. So sometimes you can see kind of that spiral effect in families where somebody's flipped their lid, then the other person flips their lid, and then everybody flips their lid. And that becomes a really uncomfortable, not a very nice place to be sometimes as a family. So we know that the quickest and most effective way to get that lid back online is to connect with them. So for them to feel connected to, heard and understood. Well, that's not always so easy when you flipped your lids, maybe too. So this is one of the most difficult things for you to do in the moment. So please don't feel like a failure if you don't manage to do this all of the time, because it can be really hard while they're displaying some of the behaviors that you see. And also the other thing to hold in mind, if you're really dysregulated in that moment, actually it's really difficult to help your child regulate in that moment too. So we can also help sort of by prioritizing connection over what we call correction, which we'll talk a little bit more about in a minute, to bring that upstairs part of the brain back online. That's what we're going to talk about next or in a little while. Okay, so one of the things that happens in the upstairs brain is things we call executive functioning. So that is a big word for the afternoon. The brain's ability to complete everyday tasks and achieve long-term goals. So it requires all of the elements that you can see on this slide, and we'll talk about them. We'll work through them in a minute. We know that for some of you who have children who are neurodiverse, they may really struggle with some of these skills. So we also know that all of our children grow at different rates. So what we might be seeing with children who struggle with challenging behavior is that their executive functioning is just a bit sluggish, maybe. What we are trying to help you think about today is how we can support the development of these areas for your young person, rather than getting stuck in the cycle of them going to the challenging behavior to get what they need or to avoid what they are struggling with. So this is looking at impulse control and emotional control, thinking about before acting and keeping things in check. Those with diagnoses of ADHD might find this particularly difficult. Now we've got flexibility of thinking, so adjusting behavior to unexpected changes. Some of you are talking about actually my kid really struggles when we change a plan, maybe. So that might also be particularly difficult for young people who may have a diagnosis of autism as well, where we know that that change in routine and plans can be really impactful on them. So the next one's working memory. So that's about keeping key information in mind while using it. So it's such an important skill, and it's particularly heavily needed in school settings often. So it might be things like turn to page 3, read the caption, answer the question, and then give me that kind of answer sheet back at the front of the class, for example. Just one example, or you might give them a list of things to do. So this is kind of where some children find it really difficult to manage that. And you might have to give one instruction at a time, for example. So self-monitoring. So that's about being aware of how one is doing in the moment. Really hard for sort of one for many young people to do. The next one's planning and prioritizing to set and meet those goals. So if you're getting ready for school in the morning or planning other everyday things, it's difficult for your young person, then this might indicate that they struggle with this skill and need some support around this. Task initiation, so taking action and getting started with something. So things like starting homework. Some of you were talking about homework being a bit of a trigger and something that's really difficult. Organization, keeping things on track both physically and mentally. So executive functioning is a big task of childhood going into adulthood. We know that developing skills in all of these areas is going to be really important in adulthood. All of your young people, they're developing these skills, and this will be different for them depending on their age, stage, and neurodevelopmental or learning needs. So we can think about how we, as parents and carers, can support them with the development of these skills. Okay. So thinking about this skill development, we wanted to introduce you to an idea from Dr. Stuart Ablon. And there's the link to the YouTube video will be in the slides that you'll get at the end. So, and this person is who is thinking about moving from kids do well if they want to kids do well if they can. So he does a short TED talk, which is the link that we've attached, and talks about a deficit of skill, not will. So often there's this idea that children want to do something or can't do it or don't want to do it. There is a notion around discipline that children are always making a choice about whether they want to do well or not. So, based on the assumption that kids don't do so well because they don't want to, rather than they are actually in a situation that they might not know how to do something, they might not have the skill which allows them to do certain things. So, based on this notion, it's an appropriate approach. I'll put my tongue back in that rather than working on the young person's will, it's working on their skill and helping support them to develop skills in those areas discussed in the previous slide. So, with this approach, it's about being proactive about thinking proactively about different behaviors and doing some role modeling about that. For all young people, some of these skills they're developing, as we know, that upstairs part of the brain isn't fully developed yet. So moving away from they should be able to problem solve, work it out, display frustration tolerance to focusing on what is my child struggling with and what do they need, which could help them in the area and giving opportunities to learn this in the moment and providing opportunities to problem solve and supporting them. This will help to develop the skill. So we have to kind of build some of those opportunities for our children. That's the key. So, and it might be that there's a degree of empathy to understand the problem from the young person's point of view, collaboratively brainstorming together a solution. So it kind of moves around from blame. Why can't my child sit down and concentrate in their lessons? To what does my child need? What skill might they need to develop to enable them to learn this skill? We're giving permission to parents to reward their children if they manage to do something that they would likely struggle with. So, for example, sitting still for 5 minutes. Let's celebrate it. It might not be the 30-minute lesson, but 5 minutes is a successful start. So let's celebrate those small gains that are actually really big gains for your young person. So let's provide more opportunities for recognizing those things which seem small but actually are huge for that young person. And it will help build their confidence and ability to further develop their skills. And, this might be more difficult for some children who have specific delays in their development or their learning. But let's still use that approach to think about what are their kind of gains and celebrate them at every term. And those children might be trying harder than anyone else in the class to concentrate. So if concentration is something that's really difficult, your kid is investing a lot of energy, even if they look like they're not managing it very well. But they often won't get the recognition for those gains that seem very small to others, but are actually really huge for them. So you can also start to feel more positive as a parent. So if you kind of start going on that journey of celebrating what feels like the small gains to you, actually become really big kind of gains to you and your child. So, and it builds a lovely kind of positive sort of parent-child relationship quite often. So, so don't kind of set your goals and your expectations based on everybody else. Think about your child and kind of think about how can we help them have that sense of success. Okay, we're going to move to a slider because I've done a lot of talking on those slides. So information overload, but you will get the recording so you can listen back as well. So do you find yourself, and I guess you've got some options to choose from here, um, and these are often things that happen in busy households all of the time, but if you have young people who are struggling with those executive functioning skills or might have sensory needs, these things are going to be really tricky. So So sometimes unintentionally, we might be doing things to try and speed things up because that's what we do. It happens in my household too. Um, because we need to get things done sometimes, which can actually be a huge challenge for a young person. Okay, so assuming your expectations are understood, yes. Okay, calling things out from a distance. How many of us shout to the next room or the one beyond that? uh, Giving a series of instructions. So if you're holding in mind some of that information we shared about executive functioning, we might kind of go and get your bag, go and get your coat, go and get your shoes, put your coat, shoes, and bag on. We're heading out the door. Meet me in the car at the car in 10 minutes. Actually, that's so much information, isn't it? And some of our kids can't manage that. So, but we all do it. So, okay, so calling things out from a distance, we've talked about. Okay, transitioning without warning. And we sometimes do that as well. It happens a lot in schools sometimes too. So, okay, we're going to move on to thinking a bit about sort of some more of those strategies. So we sort of talked briefly about correction before correct connection traps earlier and wanting it to be the other way round and how hard that can be sometimes. So, as we manage the tricky balance between being caring and disciplining our children, because that's a tough balance to kind of get right, isn't it? Sometimes we may find ourselves in a habit of reacting in some of these ways. And Dr. Mosley calls them the correction before connection traps. So, and we've got a lovely list of some of those there. So, maybe we ignore, we invalidate, and these sound really harsh, don't they? Um, but sometimes we can fall into some of these traps. We give negative attention. Somebody was saying earlier, oh, I do shout actually. We threaten the punishment. You'll have your phone taken away. I can imagine many of us parents in this room with sort of teenage children, particularly, have definitely kind of gone to that one along the way. Provide an immediate solution to the problem. Do a task for your child or giving into their demands because sometimes it's a bit quicker to do it yourself, isn't it? Um, Distract, impose more rules, declare disproportionate or unexpected consequences. So these are things we do while juggling life's pressures and our own internal world at the end of the day. So this is not about us placing a judgment on you, but these are just the traps that can occur in those busy kind of times. And as parents, we will find ourselves responding to our children's flipped lids in these ways, in situations where they're being non-compliant often when we need them to be cooperative and when we're short of time and patience. So maybe that's the busy school run, resting, going to bed. It can be all sorts of different situations. They're kind of getting ready to go out to a sports club, maybe, or any of those things can sometimes become a bit of a fighting battle. So, in these tricky moments, when these often become our go to quick fixes, but you will all have experienced some of these quick fixes often lead to further challenges. So they don't often resolve the situation, which in the long run can take up more time and energy, actually. So, for example, our child's distress further escalates into more difficult behaviors. So, think about maybe a time where your child's done something and you've maybe shouted or you've kind of flipped your own lid, and then has it resolved the situation or has it kind of often made it much worse? So, although these correction before connection traps are a natural part of parenting, if we get stuck in over relying on them, we miss opportunities to help support our children to learn healthier ways to understand and deal with feelings. So we need to strengthen the connection before the upstairs, so the upstairs and the downstairs part of the brain kind of reconnect. And that enables us to have better conversations and problem solving together. So the next strategy is about scaffolding our children towards success. So these are some key messages taken from a great book, Calmer, Easier, Happier Parenting. Sounds very idealistic, but it is a great book. Um, if it gives us some really concrete, helpful tips. So what the author, who's called Noel, talks about is parents around how we develop these skills they need and encourage them to have more opportunities to manage success and feeling positive. So, how can we give more positive attention and energy when we're potentially already not feeling full of energy as it is because we're battling these behaviors at the minute? So, thinking around focus on planning so that things go right rather than reacting when things go wrong. So, thinking ahead a little bit. So having clear rules and expectations helps with this. So everyone is on the same page. Have you mapped out these things together as a family, maybe, so that things are clear and understood? Remember, some children will need more clarity on this than others. So some might need a sort of real step by step or real kind of visual around this. Having consistency in terms of rules and consequences is also a key here. You can also map this out as a family so that everyone knows and everybody knows the consequences are proportionate and followed through on and also understood. So, so you kind of know what to expect. Preparation of the environment to make things easier for kids to do things right. So this is linked to creating routines, maybe. For example, getting clothes ready in the morning can support your child to begin to learn to dress themselves. It also makes the pressure of you in the morning to support them to learn that skill. So having clear bedtime, dinner time, and morning routines can be really beneficial for everyone in the household. Planning your day realistically so you have enough time and remember you're allowed to get it wrong too. So don't feel like you have to manage to do this all brilliantly. You need to give yourself permission to get it wrong sometimes, therefore. So all families have arguments. So, I'd like to meet one that doesn't and falls out, and this is normal. So repair is so important here. So acknowledging and saying sorry if I've overreacted and accepting an apology from a young person without going over all the behavior again. I'm sure some of us have fallen into that trap. These opportunities are going to be so important for them to build relationships and have strong family relationships and attachments. It's the repair that builds the resilience at the end of the day. So it's okay to get it wrong, but it's what you do with that that really counts. So incorporating quality time, it doesn't have to be hours. Sometimes you don't have hours in a busy household, but even a small amount of time is key. So it's especially important to do this when they haven't shown some of those behaviors that we've talked about. This can be doing anything together, playing something, talking, or even just sitting together if you're very tired yourself. And it's really helpful thing to do, just being with your child. Maybe just sitting alongside your child who's gaming, even. Taking a curious interest is what you're doing, and that's the important point. So it might be in those moments your child really opens up to you about what's on their mind. This will help to build those connections. Sometimes people talk about it's easier to chat in a car, for example. So, I've got two children. My son likes to talk in the car when we're driving to football. My daughter likes that 5 minutes at bedtime, and she'll tell me all about her day when her brother's not around. So think about some of those small pockets. If you've got bigger pockets, amazing. But if you don't, think about those small pockets. Okay. So if you feel that your child is struggling with those executive functions that we talked about earlier, this might be a really, really helpful slide. And I won't go into this massively here now because of time. But there's a lovely website attached at the bottom, which will give you lots of information too. So it's worth having a look at these resources if your child struggles with executive functioning. And it's also really helpful to share that with school if your school isn't aware of it, because having those conversations, how do you manage some of those struggles, can be incredibly helpful. And thinking about that at school and at home, and can increase the sort of positive experience of your children if those are the things that they struggle with. And there's just a few ideas on this slide.
And just to add to that, we've got a workshop, haven't we, Emmy, on
We do.
planning, organising, and remembering as part of our neurodiversity parent carer workshop program. So that might be one to access as well when we go to the end about yeah, just
Yes,
if you're thinking about that for your young person.
that's a really helpful point to make. So yes. So okay, so we're going to think about replenishing our child's fuel tank to start with. So obviously none of us can function on no, our car can't function on no fuel unless it's an electric car. But let's just assume we've got one that needs fuel. So we can't do anything if we run out of this fuel. So the first focus we're going to have here at the minute is how do we replenish your child's fuel tank? Because sometimes they run out after having some of those behaviors. And so some of the ways we can do that is by giving positive rewards. So don't feel bad for giving your child rewards for small positive behaviors, even if they seem really small to somebody else. Like we talked about, really think about rewarding and building. So provide those opportunities for success, and this will build the confidence and bravery to get outside of their comfort zone. So, Leah Waters talks about a strength-based approach to building that resilience in our children. We talk about this in our Building Resilience workshop, which we've called something slightly different now, but that's available too. So, we'd really recommend that you watch that one. And there's loads more tips on how to build that resilience in your children. So making sure we're coming up with reachable goals for our children, make sure they are their goals too, so not just our goals. So really think about doing that collaboratively, ideally. Providing enough frequent breaks, maybe. So your child might be somebody that can't sit and do their homework for an hour. So think about building in really regular breaks. So you kind of asking them to do short bursts of things, ensuring they're getting enough energy, enough sleep, enough food, enough exercise. We do also have a sleep workshop. Feels like we're promoting all these workshops, Kelsey, this afternoon. If that's an area of your difficulties for your child. And the other thing to say is increasing positive self-statements. One way we can do this is to model this ourselves to our children. So, for example, saying out loud, "Gosh, I've had a really tough day. I've done really well to manage that." So kind of sort of praising yourself and showing them how to do that when things have maybe felt a little bit tough. That compassionate self-talk outload is going to show them how to do this for themselves. So you doing that, modeling it, they learn to kind of think about doing that for themselves. And you might have to help them a little bit with that along the way too. So telling your children those moments that we enjoy with them is really key. And that might be hard when you're battling with lots of difficulties at the moment. So try and remind yourself and your child of the good times rather than just focusing on all of the difficult ones. So this is about us trying to shift some of our attention and some of our focus and being more proactive in our thinking. So especially once you've worked out what the difficulties are and driving them. So what I'd like you to do is name one of your children's talents and one area you could focus on to support refueling your child's fuel tank. Sports, yeah. Yeah, that's a great one. And sports and exercise gives you a massively good feel good feeling, doesn't it? Reading, yeah. And that's if your child loves reading. So our children all love different things. And you kind of almost picked my two children because one likes the sports to release and to kind of, recharge, and the other one likes peace and quiet and reading. So remembering facts. Yeah, some children really love that, isn't it? Building up kind of a facts kind of knowledge bank. Art, nature, science, incredible memory. Yes. Oh, some of your kids sound amazing. They're really good at dancing. Quizzes about special interests. Yeah, climbing. I've recently taken to climbing wall places. Oh, there's some brilliant climbing wall places out there, isn't there? Okay. So it sounds like your kids are really quite amazing and quite varied as well. So that's really brilliant to see. Okay, so let's think about your relationship. So, your relationship is what we're trying to build here, as it's the connection with you that is going to bring your child's lids back online. Often, you know your children best anyway. So, and so it's really tough because that responsibility almost sits on our shoulders as a parents, doesn't it? So, and we know sometimes we know what the solution is to getting our kids' lids back online. Sometimes we don't yet, and it takes us a while to figure it out, and sometimes that changes. So that's okay too. So being proactive yourself with predictable problems. So when you can notice a pattern in a behavior, plan ahead and try and manage this as best as you can. And you might try lots of different things out. That's okay. You'll win some and you'll lose some along the way. That's okay. So, choosing the right time to talk about it, not when your child or your lid has flipped, is generally our advice, or at a busy time, but finding a time when things are calm to talk about it. Um, and sometimes that can be really difficult to work out because, you might want to talk about it, your kid's not ready, or vice versa. So agree that with your child and really sort of think, is your kid somebody who needs a little bit of time to just have their own space before you have that conversation? Or is it that you have that conversation while driving? So you can work this out. So, and but it is about choosing the right time and being calm enough to have that conversation. The next bit is about being curious and empathic and remaining calm. So we've just touched on that really in reality. So try seeing things from your child's perspective, even though that's really hard, and remain calm and keeping your lid on yourself. Sometimes that means you have to bite your tongue. Try not to react and further escalate things. So hard to do sometimes, but give the opportunity to come up with ideas for themselves. So try and be collaborative. So practicing these skills is going to be key here, and this includes modeling this ourselves. So managing big feeling workshop again is a really helpful one to watch, just to give a few more pointers around this. So you know what, we've kind of made you really think about understanding your child's behavior and focusing on that connection. But what we really want to acknowledge here is actually it can be a real challenge for us as a parent or carer. So it can be emotionally exhausting, and often our own needs are neglected or aren't met sometimes. So these behaviors can be triggering for us and remind us of our own difficult times sometimes in our lives. And we may flip our lids too, therefore. So don't give yourself a hard time if you notice yourself flipping your lid. We often have to do this on empty because we're kind of really running out. So our fuel tank is at the bottom. And you may not have good support that you need in place either to help you with this. So, overall, this can impact our ability to model the skills we want our children to develop. Therefore, we want to emphasize the importance of filling up your own bucket or your fuel tank, whichever way you want to look at it. So, what do you need to be refilled and refueled? We cannot pour from an empty bucket at the end of the day. So, and we can feel a bit selfish about doing things that help us refuel or refill. So don't feel selfish about it because it's so important. So doing something you enjoy, even if it's a small thing, can have such a beneficial impact. And for some people, it might be going for a bath and locking the door and having that time out and really being in that moment. Or it might be going for a walk and having some fresh air, some exercise that might be more beneficial. So we all like different things, and it also depends what's viable in your households. So hold this in mind as you reflect on this workshop and also when looking at our resources. It's not selfish to take a little bit of time to refuel or refill because you can't look after your children without refueling a little bit. So now I'm mindful of time, so I'm going to whiz us through some of the resources if that's okay. So I probably won't go into them much, and you can read those at your leisure if that's okay, unless you feel there's any specific ones, Kelsey, that we might need to draw people's attention to.
I think not the first three, but possibly the one around if they're worried about their child or young person might be
Yes, so
useful to
let's do
focus on a
that
bit
one.
more.
That's a very wise one. So key resources if you are worried about your child or young person, particularly around sort of safety or well-being. There's a Young Minds Parent Helpline, which is worth checking out. You can also phone 111, option 2 for crisis support. There is Papyrus, prevention of young suicide. And we've got some parent workshops as well around self-harm. So if that is something you are particularly worried about, please go and check those out when we send those out to you.
Yeah. And just to say, the previous slides just have some more sources of support, as well as some other things around, yeah, further reading and yeah, sources of support in this area, really.
Yeah. Okay. And for some of our older population in the group, so our older teens, some of these might also be really helpful to access. Okay, so just if you don't mind bearing with us for a few more minutes, how would you rate your knowledge of understanding behaviours in your child at this stage?
We may just need to go to the next slide again, Emmy,
Oh,
to see
sorry.
the
I keep forgetting
result.
that. Sorry. Okay. Okay, so I think we've sort of seen a bit of an upward shift, which is
Yeah,
great. And just let people, yeah. Okay, and how would you rate your confidence with understanding and supporting your child?
definitely a shift.
Yeah, a little bit of a shift. That's great. Okay, and we really value feedback from you. So if you can just let us know if you found today's workshop helpful. Okay, that's really helpful. And can you have a think about two things you're going to take away from the workshop today and what they are? I think I might have to go to the next slide, don't I? There we go. So what are the two things maybe that stood out for you that you're going to really take away from today?
It's really helpful for us because then it tells us what we should never take out when we review the workshop
And
because
we
we
do
always listen to
review them.
feedback.
Yes.
Yeah, yeah.
Okay. Reward the small things, repair and resilience. Yeah. Attention is attention. I've never thought about this before. Yeah. And actually, we all need it. So often you'll hear people go, oh, they're attention seeking. It's not a bad thing. We all need it. So I'm doing the best I can with the knowledge I have. Yeah. Connection before correction, positive reward, repair resilience. Yeah. The brain house, the upstairs and downstairs. Yeah. I found that such a brilliant find when I started hearing about that. So, okay, I've just got one more person typing, I think. Focusing on skills that are lacking rather than assuming it is in their control, connection traps. Yeah, brilliant. Okay, that's really, really helpful. Okay, one thing that could be improved about this workshop is, and again, we do really value your feedback. Give a few minutes to type. Do the school teachers get the same info? Well, that's a great question, isn't it? Um, I suppose we have had some teachers join some of these parent workshops or watch some of them. Um, I don't know that we specifically run any specific ones. I learn a lot about behavior. All is good. Okay, cool. But I guess it would be interesting to, if you felt your school would benefit from the information, is to share the link maybe. Can't think of anything, thank you. I don't have any suggestions. I'm just looking forward to seeing how we go with these suggestions. Okay, yeah, good luck to you too. I hope they go well. So, and I guess we all will take different things from this workshop and we will try different things from this workshop. So, um, I guess my advice is don't give up and just keep trying and keep trying to understand and keep trying to connect. So, which can be quite hard if you've got different children. Maybe video scenarios of typical family day, getting to school and modeling positive behavior reactions. Yeah, that's a great idea. Okay, wonderful. If you would like to give more full feedback, we have also got a QR code here, which will also get sent out with the information that you get sent after this workshop. So,
Yes.
and I think that's probably all from us
Yes.
now then.
Yeah.
So,
Just to say, you will be getting the slides and the recording and the additional resources soon. Yeah, we try and do it within 2 weeks of the workshop. So yeah, thank
well,
you to
that's
everyone.
great.
You've
Thank you,
contributed
everybody.
amazingly well on Slido. Thank you for that.
Thank you all for attending.
Thanks.